Rehabilitation of total hip arthroplasty depends on so many factors, like what is the age of the patient, what type of arthroplasty is done, whether it is cemented, non-cemented, as well as what are the comorbidities of the patient, and all these situations we are going to discuss in today's question. So the question goes something like this, that the physio is treating a patient who just underwent total hip arthroplasty with posterior approach, and that too non-cemented, uncemented arthroplasty. Now we need to figure out that which is the treatment that a physio must not give, or which activity a physio should not allow patient to do in early rehabilitation phase. And the option given to us are option number A, that we will not allow patient to go for weight bearing on the affected side. Option number B, which says that we will not allow patient to do external rotation. Option number C, which says we will not allow patient to do flexion of the hip joint, and option number D, which says that we will not allow the patient to go for hip abduction. Now, according to the given situation, we need to understand the few points from the question, that the surgery is uncemented, plus the second point is that patient is elderly population, and the third point, it is early rehabilitation phase. Now we all know that cemented and uncemented surgery always depends on patient population and what kind of rehabilitation we are expecting from that. Cemented surgery mostly are used whenever you require early weight bearing, uncemented whenever you are not looking for early weight bearing but you are looking for more of the strength component in the arthroplasty joint. Now here the given situation, it is uncemented surgery and also it is early rehab phase. Keeping all these things in mind, let's go through all the options. Option number A, which says that we will not allow patient to go for full weight bearing on affected side. Now this really makes sense because it is uncemented surgery, elderly population, early rehab phase. So we are not going to take any risk by putting complete weight of the limb on that patient's particular part. So I feel that this option can be the correct one, but we will decide it after seeing other options over here. Option number B goes something like that: we will not allow patient to go for hip external rotation. Now this really doesn't make any sense. Why? Because during hip external rotation, the femoral head is going to move in the anterior direction, and here the surgery is done in posterior approach. So I don't think that there should be any harm in doing external rotation of the hip joint over here. So definitely this option is not correct over here. Now I know that option number C many of you must have selected because it is about hip flexion. Now hip flexion, yes, definitely the head of the femur moves in posterior direction. That might be risky whenever the posterior approach is used for arthroplasty. But wait for a minute and think about it, that we are not completely restricting hip flexion over here. The hip flexion above 90 joint is restricted in early rehabilitation whenever the posterior approach is used for arthroplasty. And here in the option, nothing is mentioned like whether it has to be done hip flexion above 90, below 90. It is just mentioned that hip flexion should be avoided. So this option also cannot be correct. If it was mentioned above 90-degree hip flexion, then definitely I would go for this option. Option D, which says that hip abduction has to be avoided. Now this again really doesn't make any sense because after any kind of hip surgery, we maintain hip joint in abduction for better stability. So how can we restrict hip abduction for this patient? So this option also not correct. And as we just mentioned, option number A looks more promising over here, and that is why the option A is the correct option for this question. Now if you want to learn more question and answer case scenarios like this, then you must check out this video playlist for more and more Physioquest questions.